3 weeks ago, 75-year-old Dr. Chung was happily retired, but now he's had to return to work at his old clinic because they can't find a doctor to replace him.
It's been difficult. Got to get doctors to work. They go to somewhere where there's more money.
Total Care Medical Clinic in Melbourne's southeast used to have 8 doctors on staff. Now there's just one full-time GP for almost 6,000 patients, and if they can't recruit any more doctors, they'll have to close. Pensioners Alan and Noel Freestone have been visiting Total Care Medical Clinic for 12 years. Noel is recovering from a severe stroke, and the dwindling availability of doctors has them concerned.
Without a clinic like this, the area will be so much poorer. I will be poorer, my wife will be poorer.
Clinics say that doctors would rather work in the inner city where they can charge more money, rather than bulk billing clinics in lower socioeconomic areas. And the blame is being placed on funding shortfalls, government regulations and zoning rules for outer metropolitan suburbs.
They're creating a much bigger problem in outer metro in an effort to try to fix the rural health strategies, which is quite unfair that it's us that are suffering.
A 2019 Deloitte report on GP shortages found that there's already a shortfall in GPs working in metropolitan areas. That's expected to grow to a shortage of nearly 10,000 doctors by 2030. And it's forecast to hit hardest in the high-growth areas of the outer metro suburbs. A Senate inquiry has been launched to look into the issue, with submissions pouring in from around the country. The findings are meant to be handed down later this year, but clinics say they're running out of time. The Royal Australian College of General Practitioners has called on the Commonwealth Government to better invest in GPs ahead of the upcoming federal election.
We want longer consults rewarded at the same value as shorter consults. We're trained to a high standard in Australia, and we'd like to be able to use those skills to help the health system and save our hospital care for those who really need it.
The government needs to stand up and be accounted for. I think they need to support clinics like mine to stop them from going down.
Until then, Dr. Chung will continue to look after his patients for as long as he can. Jordan Fennell, ABC News.